going back, so in the 80s, now you have the crack epidemic come in, and that kind of morphed into more and more, hard drugs that are very difficult to get off of. What was put in place to tackle that problem? Because now it's a next level kind of problem.
In California, we went with an aggressive war on drugs. And so what that meant was an increase in policing and incarceration. And so it actually did the opposite in regards to getting people off the streets.
Love and light, everybody, and welcome back to another episode of El Podcast. I am your host, Kai Primo, and I am joined by Jesse Wright. Today, we have a very profound episode about the homelessness in America. But before we dive in, please consider subscribing on YouTube and also find us on Spotify and Apple Podcasts or wherever you get your podcasts from. This does help us continue to bring more content like this to you all. So we thank you dearly and sit back, and I hope you enjoy. Our guest today is Dr. Douglas Mungin. He is a communication studies scholar whose work explores the history and performance of homelessness and abject bodies. Professor Mungin teaches at Solano College in Northern California with a specific focus on homelessness and Skid Row. So thank you so much, Professor Mungin, for joining us today. It's an honor.
Thank you so much for having me. I'm excited to talk a little bit more about this really important issue.
How would you define homelessness?
So homelessness is a term that has kind of like a legal definition, but also like a cultural definition attached to it. So legally, to be homeless, you need to be without housing, temporary housing for at least 3 weeks, 2 to 3 weeks. And so, but homelessness, as we kind of know it, means like a person without a home, or even in the more kind of extreme measures, people living on the streets. And so I think that at some point or others, I think that a lot of us have been unhoused or have known individuals in our lives who have been unhoused for small periods of time. But when talking about like homelessness as an issue, I think we're talking about those folks who have consistently been unhoused over periods of time, over multiple periods of time in their life.
I know that you've been studying this. This has been your life's work, and being a historian of the homelessness. Can you take us through the history of homelessness in California and Skid Row?
Yeah, it's a really big topic. I think that when Americans talk about homelessness, I don't think that we realize how long we've been having these issues of being unhoused. I mean, starting since the post-Civil War, we had homelessness. You had a lot of soldiers who no longer had jobs or really places to go. And so the trains offered a way or an escape. The railroads offered an escape to find lodging, housing, work, etc. And so the stacks are the people holding like the poles with the, like the fabric behind them, like those images of early homelessness seems very quaint now. But in the 1920s, I think we saw the creation of modern homelessness, where you started to see houses, specifically houses for vagrants and housing for people who were intoxicated, begin to emerge in the East Coast, but also on the West Coast. And so a part of that movement was Taylorism, and specifically kind of the movement of industrialization at that time period of Ford, of if we are able to change the bodies and make people work, eventually they won't be homeless anymore. And so you start to see a lot of churches and a lot of community groups open these housings and open these kind of like soup kitchens, etc., for unhoused individuals. And in the 1920s, we actually see this kind of like this talking about housing insecurity emerge, specifically with soldiers who from World War I and the Civil War, who didn't necessarily get the government benefits that they wanted. So you see the first like soldiers march on Washington in the 1920s and late 1910s. And so, but I think that the modern creation of homelessness is the 1930s and the Dust Bowl and the Hoovervilles. And I could talk a little bit more about that if you want me to kind of delve into kind of like the 1930s, because I think it's a really important time period. And I think it resembles a lot of the issues of homelessness that we're actually seeing today, and how it's tied not just into kind of housing, but tied into all of these other large scale geopolitical and cultural issues that we have as a society.
Please do talk about it, because I think it's important to, and I'm sure, a lot of people will be curious to know that its true roots, and then where it is today. So yeah, please do talk about the 30s and the Depression and the Dust Bowl.
Yeah. So 1930s, we have the Wall Street crash. And so what you have is a country that is lacking jobs, lacking resources, et cetera. And so what emerges is this these Hoovervilles. And so they were named after Hoover, the president of that time period. And so what they were these collections of people who would create their own parts of town, their own shanties, these shantyvilles in the middle of cities. And so they're in Los Angeles, there's actually a Hooverville that was created like in the early 1930s that sits like right in downtown LA. There were Hoovervilles all throughout the Midwest, Hoovervilles throughout the East Coast. And so these were just collections of people who created their own communities because there weren't a lot of resources. So this was before government assistance, government housing, a lot of the social safety networks that we have now weren't around then. So people had to kind of fend for themselves. Now, also with these Hoovervilles or these shanties, you have a racial element too. So also during this point in time, you have African Americans who were also suffering from housing insecurity, et cetera. And so there becomes this like policing of Hoovervilles. So some Hoovervilles had like more police presence than other Hoovervilles. And so the Hoovervilles, especially in the 1930s, started to get this negative light cast upon them. And in some cases, a very racial and very anti-poverty or anti-poor light. And so some of the newspaper reportings of that time period talks about like gold tooth, muscle bound Black people having knife fights, etc. There's this like a couple of reports from Seattle and just throughout the West Coast of these Hoovervilles emerging. But also during this time period, you have one of the largest deportation movements in American history that actually occurred in 1932, where over thousands of Mexican Americans were repatriated back to Mexico. Many of these families were residents of California. But during this time period, we had a very anti-illegal or anti-immigrant sentiment, specifically coming from Mexico. And also you have the creation of the Dust Bowl at this time period. Now, this is where it becomes very LA-centric and very California-centric. So with the Dust Bowl, you have this migration of folks from Oklahoma and folks from Texas coming to California, because California at that time period kind of cast themselves as the escape. We have lots of jobs, we have lots of land, it's beautiful, the weather, etc. And so folks from the Midwest and the East Coast, they see these beautiful images of California with the promise of jobs and agriculture. And so they moved to California. Now, in California at this time period, specifically of Los Angeles, they started to realize that too many people were migrating in, too many poor people were migrating in. And so the Chamber of Commerce worked with the Los Angeles Police Department. And what they established is what is known as the bum blockade. And so for a 1-year period, the Los Angeles City of Commerce worked with the LAPD and worked with other outside police departments, specifically on border towns of Oregon and Arizona, to stop all trains coming into California to ensure that people had financial means and they looked like they had financial means in order to come into California. And if they didn't, well, they were sent right back and not allowed into California. And so what happens is that we now have this policy of who can be in a state, who can't be in a state. We have this huge deportation movement. We have these Shantyvilles that are coming up, these Hoovervilles. And so the 1930s represent this really big change and this movement to talk about housing insecurity, to talk about what does being an American citizen mean? What does migration mean during this time period? And then the federal government begins to act. And so during this time period in 1935, we begin to establish the social safety network. And so we start to have jobs programs specifically for men so that they can be the breadwinners of their house. We start the high wave movement in which now people have jobs for that. And then also we start to clean up these Hoovervilles. And so we start to create public housing, specifically in more urban areas. And so just kind of looking at that brief history of the 1930s, we see that this history of homelessness and housing and just all of these issues they kind of harken back to like what we are experiencing now. And we kind of see how connected a lot of these issues are. And then in the 1940s and 1950s, I mean, you start to see the second great migration of African Americans moving out of the South into these urban areas. And so what happens is you have these urban areas that in many cases, we're not ready for segregation or integration. And you now have a huge influx of folks coming in. And so the modern unhousing movement or the modern homeless epidemic has like multiple levels. And so when we say like, oh, the issue of homelessness, I think you have to consider like which wave of homelessness that we're currently in. So the wave before the one that we're currently in, I think we can see began like in the late 1970s, early 1980s with the crack cocaine boom, and specifically the NIMBYism of downtown areas. And we'll talk a little bit more about that. But the situation in LA and specifically Skid Row comes from like this movement of the 1960s to transform downtown areas to make them more commercial and for people to come to. And so you have places like Chicago, you have places like Seattle, you have places in New York, like the Bowery. And then you also have in LA, this little part of town called Bunker Hill, which is right next to downtown LA. And so these areas got basically razed. And a lot of businesses and high rises took over these formerly kind of like communal working class areas that were close to downtowns. And that wiped out a lot of the housing for poor folks. And it wiped out a lot of the resources for a lot of poor folks. And so in some cities like Seattle and Chicago, those folks moved to different parts of the city. And places like New York, they went to other boroughs. In LA, those folks that lost their housing moved to some districts, but predominantly if you were like and living in abject poverty, the next place to go was Skid Row.
Phew, let me just take a breath. That is
sorry if I'm going too fast or if I'm jumping around, just let me know.
No apologies. So it was FDR that was he the first president who started putting things in place, social programs for a lot of these people that didn't have homes?
Yeah, so I mean, there were government programs for folks who were in the military, and then there were some programs by like churches and whatnot for young men. And so those have been around since the early parts of the 20th century. But in regards to like federal action, that was kind of like the really big federal movement was in the 1930s, mid 1930s, 34 through 37, 38.
From the 60s and 70s, how did we get to this phase?
Okay,
of homelessness so I think in California? I probably jumped a little too fast there, but we might jump around. But
no,
just
this is
to connect
perfect.
the history. Yeah.
This is perfect. So this actually brings us to Skid Row. So in, like I was saying, in Bunker Hill and other places in the 1960s, it became like this reimagining of downtown as this commercial space. And so in 1970s, LA actually wanted to do the same for Skid Row. They wanted to actually raise Skid Row and make the downtown area like more beautiful. So for those that don't know, Skid Row is a 10-block area located right next to downtown Los Angeles. And so it has the highest population of homeless individuals or unhoused individuals in the entire United States. And so in the 1970s, this area wasn't as big as it is now, obviously, in terms of population, but it was still housing the most unhoused populations in the city of Los Angeles. And so in 1974, what was proposed was a silver book. And so the silver book was a plan by the city government of Los Angeles to raise Skid Row. But when other cities close to Los Angeles, and also when homeless advocates found out about this, they were like, there needs to be a change. So the homeless advocates were saying like, hey, we have a great base here in regards to services. We have everything that's kind of like necessary in a centralized location. All we need is more additional housing, and we can actually like deal with this issue of homelessness and give people what they need. Now, the outside folks who also joined this movement just didn't want homeless people to move into their areas. They saw what happened in Bunker Hill, where people, where that area was raised, and so folks moved to different areas. And so they didn't want homeless people to move into their areas. And so they joined in with the homeless advocates to create what is called the Blue Book. And so the Blue Book is the creation of what is modern day Skid Row, confining it to a 10-block area with a centralized location for services and an allotment for housing. And so that's kind of modern Skid Row. And so that kind of centralized ghetto, in a way, becomes kind of a model for other areas across the United States of, if we centralize like all the resources to this area, everyone's going to come here. And so you can see that in like areas like San Francisco, the Tenderloin area. You can see that probably even in Puerto Rico, right? Like there's like a centralized location where folks get their resources. What's interesting to me, though, is that once the Blue Book goes in, there was supposed to be housing, but that housing never came. And then in the 1980s, you have the crack epidemic, and you have Reaganomics, and you have like a housing crash. And so you now have a large African-American and specifically kind of like Black and brown folks who are now addicted to hard substances. There's no real place to go in LA. And so Skid Row becomes this huge area that now represents the modern homeless kind of epidemic, not only in California, but across the United States as a whole. And since the 1980s, Skid Row has kind of been that place. And so what's interesting is like, homelessness isn't really just confined to just like Los Angeles. Like people in Los Angeles aren't all homeless, and then that's the whole population. Like there's homelessness throughout the state, and there's homelessness throughout the states around it. And what we see is that because of certain policies, by aggressive policies in regards to like slow growth, which is we refuse to like provide more housing for local people to move in, a lack of building high density housing, just zoning laws, etc., from different cities, that it forces out poor folks, and it forces out homeless folks. And so the only place to really go is the place that has the resources, which is Skid Row or other areas. And I think now we're starting to realize like, hey, this 20, 30-year period when we could have done something, and we had cities all around us refuse to like take an effort into building housing. Now that, you know, like we have gone through an economic two economic downturns in the last 10 years, plus, you know, rising costs of everything and COVID, we're starting to see now that folks need housing, and folks who were able to purchase housing just 10 years ago, or even rent a house or rent an apartment, aren't even able to do so. And so the unhoused population now is not just folks living on the streets or with addiction. These are students. These are people with jobs. These are people living in their cars or living in hotels at this point. And so it's not just an issue that affects certain populations in our society. I think it touches all of us now.
What is the history of that term, Skid Row?
Oh, yeah. So Skid Row actually is an old term for logging. And so when the loggers would cut down the trees, they would take them down to where they would be processed. And that was what they called Skid Row. They would skid the logs down the row. And on those skid rows, we would have like businesses and bars and cheap housing for the folks who were loggers. And so you would have like really cheap beer and you would have cheap housing for like a day or so. And then the loggers would just move town. And so that's where the term Skid Row comes from. And so like every urban area in like a major city that had like a docking area had a Skid Row at one point.
That's very interesting to know. And so now going back, so in the 80s, now you have the crack epidemic come in, and that kind of morphed into more and more, hard drugs that are very difficult to get off of. What was put in place to tackle that problem? Because now it's a next level kind of problem, and you can't just build housing and solve it. Now you have to treat that differently. No, did they do anything at that point?
In California, we went with an aggressive war on drugs. And so what that meant was an increase in policing and incarceration. And so it actually did the opposite in regards to getting people off the streets. And so this is what usually would happen. Someone would get arrested for drugs. They would go into prison. And then when they were released out of prison, there was really nowhere for them to go. But, where all the services were? On Skid Row. And so Skid Row has an amazing amount of services for people who were formerly incarcerated to get them housing, et cetera. And so what happened is that because of the war on drugs and the high incarceration rates, we had the prison being completely overpopulated in the 1980s and early 1990s. And then when those individuals would leave prisons, the only places for them to go was to Skid Row or was to other Skid Rows across the areas. And so it didn't actually help at all. It actually increased in some capacities the amount of unhoused individuals because now they were away from their communities. They now were harder to get jobs. And now the strain on the services and the resources of Skid Row were being put more on the line.
In your dissertation, you say, quote, "Through my 4 years on Skid Row, most personal narratives followed a distinct script. Person does drugs, person gets in trouble, person loses it all, goes to jail, comes out of jail and is taken to Skid Row, placed in some kind of rehabilitation or job program, goes back to the drugs, goes back to the rehabilitation / job program, insert some religious transformation, life turns around, finds a job, becomes the person you see today." End of quote. Can you elaborate on this cycle?
Yeah, so I think that when folks talk about Skid Row or kind of talk about what Skid Row is supposed to do, I think that it misses some of the complex narratives of Skid Row. And so the traditional narrative is kind of that one of I went to Skid Row and I found myself and I became something better through this kind of trials and tribulations. And it follows a narrative kind of from the 1920s of if we just get this person to work and if we just get these person into religion, this person can break out and make a better way. And I think that removes some of the necessary resources that person needs, right? That one, they still need housing, they still need community support, but also realizing that Skid Row operates as a community also, that it's not just this personal conviction that can lead it out. I think that the power of a place like Skid Row, and I think the reason why I kind of study this is that narrative also doesn't necessarily talk about the folks who come back to Skid Row and help. And I think it's because Skid Row is a community. And I think it's one of the most long lasting communities in Los Angeles and in California. And you have this narrative of community help. You have this kind of community atmosphere where people really look out for each other. Now, granted, there is a lot of drugs and there is a lot of violence in Skid Row. It is a horrible place, do not get me wrong, but there is also beauty in that community also. And I think that that traditional narrative or script that we have takes away from the complexity of a place like Skid Row and takes away from the complexity of what does getting out of addiction look like and what does like housing, getting back into housing look like for a person. So I think that's part of what I'm trying to like untangle in our narratives about homelessness in Skid Row is that we have this idea of what a homeless person is or looks like. And we need to completely throw that idea away because to deal with modern homelessness, we have to really think about it in a modern, unique way.
Yeah. In chapter 4 of your dissertation, you had a quote that I really found to be quite illuminating. It was by the famous author Arundhati Roy. Hopefully I pronounced that. And the quote is, starter quote is, NGOs have a complicated space in neoliberal politics. They are supposed to mop up the anger. Even when they are doing good work, they are supposed to maintain the status quo. They are the missionaries of the corporate world. End of quote. Why did you include this quote in your paper with regards to homelessness?
I think it's one of the most complicated issues is that you have organizations that are there to do good work, but unfortunately, because of bureaucracy or because of the Byzantine nature of like grants and zoning and et cetera, that they are kind of doomed to fail. And so it makes the state or it makes kind of the government look like it's doing something. But in reality, they are doing the NGOs or the kind of nonprofits are trying to do the best that they can, but they lack the resources. And so they're not able to do the job that they need to do. And so the job that they're doing is in some cases it's a valiant one, but in many cases it's also inadequate. And I think we can see that through kind of the process of the last couple of years. Right now, we're kind of seeing that with a couple of years ago in 2016, Los Angeles passed Proposition Triple H, which was to bring, I think, like $800 million of funding for new buildings and housings throughout Los Angeles. And what has happened is that we've only built like 25% of the housing that we said we were going to build. And now the housing budget, the price of creating those houses and creating those buildings and units has actually like gone up by over like $200,000 in that time period because of the housing bubble, et cetera. And so what happens is that you have these great ideas and these NGOs wanting to make a difference, but when the state gets involved, it doesn't really make that much of a difference as it's supposed to do. And then you have a general public that is now upset at nonprofits and the government. And now what happens is like, we no longer give money to that cause. We expect that money to be used quickly and efficiently. But as we see with an issue like homelessness, it's going to take more than 1 year to fix an issue like this.
Yeah. Speaking of policy, I've heard a lot, or people talk about this, that there are a lot of neoliberal policies that really made this problem worse. Like, it doesn't seem to be getting better. The drug epidemic is worse and worse, which is expected because it's, getting off of drugs is just really, really difficult and very expensive to help someone to get off it. But talk about, has neoliberal policies made the problem worse, and how?
Yeah, I think that neoliberal policies have definitely made the problem worse. I think that beginning in the 1970s, you see this kind of like de-investment of urban spaces, specifically like in like Los Angeles, other places where America becomes this giant suburb, and where usually like the arteries of the suburbs were to go into the cities, and now it's vice versa, where the cities in the 70s and 80s became places that people didn't really visit or were scared of. And so what emerged was, instead of city governments helping these cities build or using those resources to like really beautify or like create resources in those cities, you had nonprofits and NGOs come in and basically do the job that we pay our taxes for, right? And so when these NGOs emerged, they're not as transparent in terms of like their practices and also what their goals are, especially in regards to things like homelessness, right? And so like how much do you actually need for the beds and for shelters, et cetera? And so it's difficult to find out like which organizations are there and want to build that community, and which organizations are there because they can get grants to build to provide services for those communities. And so when you have these organizations that are coming in and getting a lot of money, but are able to leave those communities, you're also leaving those communities without those resources again. Or some of the policies aren't not necessarily reflective of the population. So in the 90s and 2000s, actually in like the last 10, 15 years, there were a lot of programs and organizations that were that came in to revitalize a lot of the old hotels in downtown Los Angeles and revamp them into SROs or into apartments for formerly unhoused individuals. Now, when those organizations come in, they get a lot of government funding to kind of redo those housing. But what happens is they have really strict strict policies for residents, things where it's like they can't leave their house after 8 p.m. They can't have guests. They can't do this. They can't do that. Just like a laundry list of things that they can do. So it also, those individuals who are unhoused are now treated differently, but also just in terms of safety and quality. There was one specific business that had numerous complaints about lack of water, lack of heating, electricity being shoddy. And then that same company had a convalescent home in Vallejo burned down in the early 2000s. But this was still a company that was getting government grants to do work in Skid Row. And so it's things like that when I'm talking about NGOs and I think that's with any business, but I think it especially hurts when we're talking about unhoused populations where the resources are so little. And when we have these neoliberal policies and these neoliberal organizations, they can really hurt a cause more than they can help.
So this next question is actually, Jesse researched these numbers, and it seems like there's an allocation issue here of funds. So in 2021, the U.S. federal government spent over $51 billion of funding for homelessness and housing programs. So this doesn't include city, county, or private dollars invested in homelessness and affordable housing as well. So we just kind of calculated a number. We have over 500,000 homeless people in the country. So we took the 51 billion, divided it by number, and this is an average. And of course, cities spend differently. San Francisco has a bigger budget than, say, a smaller town. But that works out to about, say, $92,000 per homeless person. So that's over 27% more than the average housing income, the household income in the United States, which is about $70,000. So if there is such a big spend per person, and I know that this is like such a much more complex, just curious, how is this money being allocated and used? It seems like there's so much money being put into this, billions. Yeah, where is it going? And we have an idea, but
not all the money gets used. And that's the real issue, is that because of zoning policies, and like I was saying earlier, NIMBYism. So in some cases, we allocate money for high density housing in some areas. And then we're met, those policies are then met with intense pushback from local communities and local governmental officials. And so it gets tied up in the bureaucracy in places that don't want to get that done, or in communities that don't want to get that done. And so you have like, well, we passed this fund and we're supposed to give this amount of millions to this issue. And so a lot of that money goes nowhere, or it gets tangled up. And then in some cases we begin to build with that money and then realize like, oh, this is going to cost a lot more in regards to building these units than we originally thought. And it's taking a lot more time. And so I think that, unfortunately, the issue with funding is that, yeah, we're spending a lot of money on homelessness. 2 weeks ago, even in California, a couple of the mayors were supposed to meet with Governor Newsom to discuss homelessness. But Newsom said, I am not going to allocate any new money for homelessness because we've already allocated a lot in cities and states and localities. They need to do something about this. They need to like be more aggressive in the funds and resources that they have. And so you see places like Los Angeles and San Francisco and San Diego even are really working hard to kind of stop this issue. And I think that but also other places around the region are doing old strategies that aren't working. Well, so a lot of them are like, well, if we don't provide the resources, they won't be here. Or if we have aggressive policing and stopping encampments, they will move away. And unfortunately, that just pushes more folks into areas and strains the resources for those areas that actually are doing something.
My question was, California and New York State combined have about 18% of the total U.S. population. But they also, 50% or so of the homeless population reside in those two states. Why do you think that is? Do you think that's policies in those states, or is it economic issues, or?
Yeah, I think it's policy. I think it's economic issues. I think that those were also the states with the highest populations, right? And also some of the issues that America has been going through the last years in regards to education, in regards to addiction, in regards to abuse. I think that's a big part of it also. And also they're able to be counted. I think that one of the issues that a lot of folks who study this work are not realizing, but they've realized it for the last 10, 20 years, is that we have severely undercounted rural homelessness. Of the amount of people who are housing insecure in rural areas in America is way more than we have accounted for, and just kind of temporary homelessness that people are experiencing. And so I think that the counting also plays a huge role, that some cities and some states don't really do credible accounting of how many unhoused individuals are actually there. I mean, it's a dirty secret in some cities about their homeless population, or they don't even want to acknowledge it. And so I think that that's a big part of it, is the accounting of it, but also that these were the cities that were hit really hard in regards to the war on drugs, the crack epidemic, and other societal issues. And so you're seeing the aftermath of a lot of these movements, but you're also seeing some really amazing folks do work in those communities also. And in those communities, like amazing resources and groups, et cetera. And hopefully that can spread around, because ignoring this problem has just allowed it to spread. It's no longer just a Skid Row issue or an LA issue or a San Francisco issue. It's everywhere in America now.
For those municipalities that underreported or don't report it accurately, what is the motivation? I mean, I would think they would get more funds if they were to even inflate the number. What's the incentive to de-inflate the number or to make that number appear lower?
Well, I think the number to appear lower is that, one, is there an effort to kind of account for that? And if there is a lot of money, I mean, usually a lot of these municipalities don't get a lot of money for unhoused individuals or for even a shelter. Most of these counties only have like one shelter available for people. And so the money's just not there anyway. So I think that with the push now that we have nationally, I think that more folks are ready to do that accounting. But for some places, if we don't say it's a problem, it's not a problem, right? And so if we can enforce or police our way around it, or just not talk a way around it and keep those people moving and eventually move somewhere else, then it's no longer our issue.
Right. You were talking earlier about how the 1980s, you had the kind of the crack epidemic, and that really put a burden on Skid Row. In 2021 in the United States of America, drug overdose was the fifth leading cause of death, with over 143,000 people, with fentanyl being responsible for about half of those deaths. And just to kind of put this into perspective, this means that more people died from drug overdoses than people that died from Alzheimer's disease, the seasonal flu, pneumonia, and diabetes. Do you think that this opioid epidemic that we're currently going through is contributing to kind of the rise across the country? Kind of
Oh,
like the
absolutely.
crack.
Yeah.
Yeah, go ahead. I'm sorry.
Yeah, absolutely. I think that in the last 10 years, especially with the opioid epidemic, we're seeing a rise in the different types of folks who are homeless. I mean, you can trace America's addiction through by just looking at our homelessness. So in the 1920s, the 50s, it was alcohol. Like most folks who were homeless were suffered from alcoholism. And then in the 1980s, 70s, and 80s, you have heroin and crack, and now you have opiates. And I think that that rural homelessness issue that I was talking about earlier is a big, like opioids are a big a contribution to that that we're now seeing. But also just in our cities, that folks that the resources that we have is for an old problem, and we still need to develop tools for this new opioid problem that we're currently having, or else we're going to see a new phase of homelessness that I don't think that we're ready for just yet.
It's just like so heartbreaking. I want to cry. So the drug epidemic is such a massive issue, and once again hyper complex to solve. And also that leads to mental illness and so on. And so now you have these categories of homeless people that you can't just put them into housing and then problem solved. So we recently saw this movie called Body Brokers. And so it was a story of rehab centers that were exploiting drug addicts after the Obama Affordable Care Act was passed. Then they would, fill a bed to a rehab center, and they would pay them to go to a rehab center, and then hook him back into drugs, get him back out on the street, and then bring him back in. And so it became this cycle of business. And these rehab centers and in outpatient, they were making millions of dollars. And so there's this. I'm just curious, like, is there like a homeless industrial complex? Like, it seems like people are profiting from this problem. And there's not just that, there's also CEO salaries of some nonprofit organizations are just hyperinflated. You got pharma, you got for-profit prisons. And I was just curious, like, is there any oversight, or am I not seeing something, or is there a homeless kind of industrial complex happening here? Because that's like a lot of money that's
Yes,
going to the wrong
there's a
places.
lot of money in homelessness. I think we were talking about that earlier. So what's funny is that the what was the movie Body Snatchers?
Body brokers.
Body Brokers, it's very it resembles an issue that was going on in Los Angeles in like the 1970s. So in the 1970s, the federal government no longer allowed for psychiatric hospitals, state-run psychiatric hospitals. And so what emerged were these outpatient facilities, a lot of them in Venice Beach, a lot of them throughout the different areas and communities of Los Angeles. And so there wasn't a lot of oversight for these outpatient communities. And so the folks that would live in them were traditionally folks who were suffering from addiction, et cetera. And they were just kind of like in the streets, and they didn't really care about them. There were a lot of fires, et cetera, on these buildings, just really bad resources in regard to this. And so that actually led to the creation of Skid Row, because these communities didn't really want these people there. And so Skid Row kind of got created because of these outpatient facilities. But in regards to kind of oversight, I think that's one of the big issues, that in regards to like how many grants are out there, that a lot of this money goes to construction, right? And so it's not really going to the services, the direct one-on-one services in these areas. A lot of this money is going to construction and folks that aren't not from these communities. And so the folks from these communities, like I know that like CEOs of nonprofits making a lot of money, like that's a big issue. But also we have to realize like the folks who are working day to day aren't making as much money as they should be making, right? And so making sure that
I agree with that.
yeah, like making sure that just because you work in nonprofits doesn't mean you also deserve to be paid poorly, is like an issue that I think that we as a society need to like really change. But I think a lot of this money isn't really being controlled by the folks who are directly impacted, are the folks who are in these communities. So the housing issue is still one layer removed from the needs of the community. And so because of that, we're spending a lot of money trying to fix an issue, and we're guessing on trying to fix that issue because no one actually is bringing the people who are impacted to the table like they should be. I can't tell you how many times like I've been on Skid Row and it's like, if people would just listen to us, this is what we need in this community. And unfortunately, folks just haven't been able to listen to folks in those communities because we have this idea that we know better than the folks who are going through that issue. And because we're spending millions of dollars, we think that we should be able to tell them what to do to fix their lives or to get off the streets. And we realize like this is a much larger issue than just getting someone off the streets, that we're talking about issues of, in some cases, domestic violence. In some cases, a lot of the homeless population are LGBT youth, or especially in Los Angeles, especially in America right now, formerly foster youth, unfortunately, is a large part of our homeless population. And so just giving someone homes, yes, that's a great step that also needs to be part of another multifaceted solution, that we just can't expect to build homes and the issue to go away, that we're seeing cracks in our system, like in multiple systems here. And if we only think that this is like just one solution is going to fix that, then we're going to be building more houses again in another 20, 30 years and wondering where the money went.
Yeah, one of a common narrative that you hear is that, once these mental institutions were, once the regulation was kind of reduced in 1963, JFK is actually his last thing that he signed before he was assassinated was what we were talking about before with the mental institutions. And then, then like the 1980s, I think maybe it was like the full effect. But do you think that's actually as impactful as people make it out to be? I mean, because then people never talk about JFK. They always kind of attribute it to Reagan. But it was
Yeah.
but it was JFK that signed that.
Yeah.
Reagan obviously had other policies, but do you think if that never was signed in 1963 by JFK, that we would have a different situation, or you think that it was just going down that path anyways?
I think it was going down that path anyway. I mean, in urban areas, you still had abject poverty. You still had homelessness. I mean, now you have another population that gets thrown into that. But I think that these are larger issues. So there was a recent poll in Los Angeles that stated that 1 in 2 African Americans knew someone who was unhoused in the last 3 months, and 40% of Latinos and about 25% of white Angelinos. And I think that just goes to show not only just kind of like the separation, but also that these are policies that have played a role historically in these communities, that we're not just talking about one policy, we're talking about kind of like historic disenfranchisement of certain communities within certain cities and the conditions that they live in. And so when those populations have one minor setback or when one resource is taken away, the next step is homelessness, right? And so I think that it's a complicated issue, but also it's a real simple one, that we haven't invested in communities that we know are one step away from this. And until we do that, we're going to consistently see those communities slip into homelessness, our housing insecurity. And I think that until we fix those major issues, we're going to continue having this. But homelessness can be fixed, but one, by housing people, but two, by finally attacking kind of the sources of homelessness. And that's a lot scarier. And that's something I don't think that we are ready for just yet in this country, I don't think, unfortunately.
One group that's not talked about too much when it comes to homelessness is the United States military veterans. I mean, they make up almost 10% of the homeless population. And I think it's so sad to think that I'm sure a lot of these are suffering from PTSD and other illnesses that they experienced either in war zones or just from being in that environment. And it doesn't really seem like that group ever really gets brought up too much. But I mean, I thought that these people had the VA and all these other programs. Like how did this group that sacrifice so much for everyone in this country, how did they become part of this, a group that doesn't have a place to live and is not getting taken care of?
One, I think it's lack of investment in the VA for a couple of decades. I know now we're trying to change that, but I think that historically, if you talk to anyone who has been a veteran or has worked in the VA bureaucracy, it is not the most well-run organization that we have in America. But I think number two is that our image of what is a veteran has changed, specifically of a homeless veteran. I think that when I talk about homeless veterans, specifically with my students, they imagine it's like an older person who was in Vietnam or in one of the older wars, and they shouldn't be living like that. But I think that we have a lot of young veterans now who have a lot of PTSD and have some things that have happened to them, and they don't look like we think a veteran looks. And I think that's a big part of it too, that like we have a large veteran population that don't look like the stereotypical veteran. And so therefore we don't necessarily see how widespread it is as before.
Yeah. I mean, I think that, it's like they're all clean cut and everything. Of course, that's when they're in the military. And once they're out, I mean, they have no dress code, no uniform. I mean, you're not going to pick them out. I mean, I have some good friends that suffered from PTSD that were in Afghanistan and Iraq. And I mean, they were like, yeah, you get back and they just give you some antidepressants, and basically the antidepressants make it even worse. And it's just,
and when they don't work, where do you go? You go for harder stuff.
Right.
And so, and so unfortunately, Skid Row and these homeless encampments are areas where you can find the stuff that you need when you can't really when you don't have the resources available to you. And so, yeah, it's a really complicated issue, I think, especially with veterans now. And it's exactly like where do we find these veterans? Because they're not in the traditional places that we have usually seen veterans. And so I think like a big part of it is also figuring out, like, in America now, a lot of specific counties produce most of our military population and most of our veterans. And I think that we need to start going back to those towns and kind of figuring out what's going on. I think that just by focusing in on urban areas, we're missing a large population that are being impacted by homelessness.
Going back to drug addiction, if it seems like the Obama's Affordable Health Care Act tried to implement rehabilitation, and like we talked about earlier, people found loopholes to make millions and millions of dollars. So they found these loopholes to. I have some numbers. It's really fascinating. After the Affordable Health Care Act, since that bill was passed, there were 2,000 sober living that popped up, 100 inpatient treatment facilities, 200 detox facilities, and there were just in Southern California alone, 12 billion annually. A cup of pee was $2,000. They called it liquid gold, and so you can pee up to 5 times a week. So per patient, that's $10,000 just in clean pee. Then you have the detox is $4,000 a day. That's 7 to 10 days. Residential would be 60 days. That's $2,000 a day per bed. Outpatient is $2,500 a day for 20 days. So that's about a 90-day period. One facility with 60 beds will rack in per year $72 million. if they kept those beds full. And so, but the success rate was 10%. And so I wonder what your thoughts are on exploitations and people finding loopholes. How do you then tackle this problem? Because I feel like uh, rehab, like drug rehab and mental illness rehab, is key. That's just my personal feels. That could be really wrong. I'm not an expert, but it's key. Like they have to be treated differently so that they get a chance to live a better, just a much better life, or they're not in the cycle of the next high, and then stealing or petty theft, and then getting high again, and then either dying or. How can we fix the mismanagement of these funds? Like, I just kind of getting maybe emotional, but like, how do we solve
no,
this?
I think that's a really great point. I think that we need better expectation on how we spend money in regards to this. And it doesn't necessarily mean it in a way in which we punish the individual seeking care, but we enforce it in a way that we make sure that they are getting the best care possible, and making sure of that. I think that as a society, we're okay with poor people getting bad care. I think we see that in regards to medicine, et cetera. But in regards to rehabilitation, it's not my expertise in rehab, but also understanding that being homeless is a traumatic event. Right. And so there's different types of rehabilitation that we need for individuals who have suffered housing insecurity. So we have the addictions to opioids and crack and whatever, but we also have trauma. We have a lot of women who have been assaulted. And I think that mental health in our society needs way more resources, but especially for this population, that in order for we want them to come back into our society, but that's a lot of trauma and that's a lot of pain and history that they're taking with them. And I think that we need more comprehensive rehabilitation, and that rehabilitation isn't just like a 1 week or 1 month rehabilitation. And I think that it needs to be way more comprehensive and long lasting in order to ensure that these people are getting the resources that they deserve. And you're absolutely right that rehab is so important. And to hear about these organizations and companies taking advantage of something that was supposed to help people and they're not, I think it goes to show how much we have allowed for people to just kind of take advantage of poor people and the systems that poor people are in. Because allowing for that to happen just sounds insane when you think about it. That's a lot of
Do you
money.
feel it?
That's a
Yeah.
lot of money for not a lot of results.
Yep. Do you think that there's some kind of light at the end of the tunnel with this problem, or
I hope
is
so.
it going to get worse before it gets better?
It gets a little sad doing the work, because especially hearing just kind of the comments that people have about homelessness, or the people who have been homeless. Myself, I suffered from housing insecurity growing up. The reason why I do this project is because my dad was, I hadn't seen my dad in 10 years. He suffered from crack addiction, alcoholism, etc. And then I found him 10 years later and he was living on Skid Row. And I found out that, he was living on Skid Row and he was volunteering while there. And so he kind of turned his life around. I mean, he still has his demons, etc. But understanding that these are people, these are family members, Skid Row's a community, and they're community members. They're part of us. And I think that sometimes that we lose our humanity when looking at others, especially in precarious situations. And I think that that's something that we really need to work on as a society. And I hope that this issue not gets fixed, because like I said before, that there's multiple issues that lead to homelessness. Homelessness is just kind of the smoke to let us know that there's bigger issues there. But I hope that because we're now looking at mental health, we're now looking at rehabilitation, and that there's money being put here, that eventually we can get folks out of these situations and not mistreated, to make sure that they get the resources that they deserve and be around the people that they deserve and can be a part of our community again, because it's been too long. And it's really sad to study, but also seeing the people who have emerged and who continue to do this fight is also inspiring. And hopefully I can continue to do that work with those folks and kind of share their stories and share their battles and talk a little bit more about this issue, because I think it's something that we all are talking about now, but we don't know how to help or where to help or even kind of where to go to. So hopefully I can be a conduit to that conversation and more folks can begin to talk about it in their homes and with their friends.
Yeah, thanks for sharing that story about your father. I read it in the dissertation, but I didn't want to bring it up since I figured that was your story to tell.
Oh,
But
thank
if you were all powerful, if you were kind of like this god of this hypothetical god that can just do whatever, what would be your policies and what would you put into place? How would you distribute funds? What would be your kind of your plan of action to actually solve this problem? I mean, everyone can talk about the problem, but unless we're actually having solutions to actually counteract what has all these bad policies that were put in place, we're just going to continue down the same path, or it's going to snowball to even a bigger travesty or a bigger situation than what we already have.
Yeah, I think the first thing is to we made years ago, we said that we would provide housing for certain areas. I think it's about time that we actually did that housing. I think the reason why we're at this point is because we refused to kind of do what we said that we were going to do as a government. Number two, I would say change zoning laws. I think that in the United States that small communities have a lot of power in regards to kind of density building, et cetera. But unfortunately, in affluent areas, there has been an aggressive NIMBYism or not in my backyardism of we refuse to have kind of transportation in our areas. We refuse to have certain kind of housing in our areas. And so until we change that, we're just going to be creating more ghettos, more service center ghettos, more skid rows in which we put people in certain areas and confine them there. So I think that until we disperse our resources as a city and everyone takes on a little bit, I don't think that we're going to fix this problem, because otherwise we're just going to be moving it from area to area. And then third, have people care. I think that for a long time that this issue of homelessness has been allowed to rot in cities, and it's not until now, people are being impacted because it's now in their communities that we're starting to care. So I think that care needs to not just be about removing people from areas that we don't want them to be in, and realizing these people don't need to be on the streets in general. No one deserves to be unhoused. So just kind of changing that perspective in regards to it. And that one is going to probably take the longest time. But I think that with those three things, we can make a serious dent. But I think also just in regards to education, more resources for women who have been abused, more resources for foster kids. We know which populations are impacted. We know what age groups are impacted, and we know exactly how the spiral begins. It's now time for us to actually do something about it.
I like kind of, I feel like there's not enough preventative measure, talking about foster kids. I mean, things need to be lined up in place before you get to the point where the only option you have is to be on the street. Once you're there, it's way harder to kind of solve that riddle. I mean, what's the whole expression? I mean, an ounce of prevention is better than a pound of cure, right? That's the expression, right? And so, what can we do to even prevent people? I mean, I feel like this is the rock bottom for people. No town council. I mean, I've worked in governments before. No town council. I mean, they might say stuff on the outside, but inside they don't want. They're not going to approve any of this stuff. I mean, getting, like you said, the local level, everyone's going to push it to the next community. I mean, you see in like you mentioned in some of the other interviews and in your dissertation, where the cops will drop people off to people or they'll drop them off in Skid Row, or people in Ohio. The cops in Ohio will give a one-way Greyhound bus ticket to LA and they go to Skid Row. So you're basically pushing the problem to someone else. And at that point, it becomes really hard because some of these people, I imagine, are just so far gone. They have to be able to help themselves. And a lot of these people maybe are past that point. So if you could get the prevention before they ever get to the point where they're too far gone, that they're never even in that position to begin with.
Yeah, I don't think people are too far gone. I think that in terms of resources and in regards of like quality of life, I mean, we all have different qualities of life, and just kind of finding that for that individual person, I think is key. But I think that your point is correct of like, how do we stop this before it gets into a big issue? And I think that yeah, that's going to be the hardest part, is convincing smaller towns and convincing these areas that this matters. And I think that in a place like LA, which I never thought was going to talk about homelessness, is now spending billions of dollars addressing this and now talking about it and wanting something done, kind of shows you what happens when there is a critical mass of folks talking about it, but when the issue hits their community. But unfortunately, I think that's the thing that has to happen, is that people have to be impacted by it. And they eventually, when it gets on their doorstep or it starts to impact their quality of life, that's when things get done, unfortunately. And I think part of my scholarship right now is kind of figuring out ways or strategies before we start making the same bad decisions. Right. Because right now I live near Sacramento, and I'm looking at the same strategies that were implemented in the 1980s. And I'm just like, this is never going to work. And I'm talking to folks in the city council, like, this isn't going to work. Like, it's never worked this way. Like, just removing the encampments without anything in regards to resources or anything built in regards to shelters is not going to help. But it's not working until probably a year from now, when the crisis gets even worse. And so I think that's one of the big issues for me, is kind of figuring out how to get people to give a damn before it gets too late.
What are your thoughts of the where people are? It's okay for them to openly use drugs on the streets in San Francisco and so on. And then it's also, I think there's a proposition that kind of allows, we've seen these videos of people can go to Walgreens and basically steal anything like under $950, and no one touches them. And so I think what did we hear? About 15 Walgreens have closed now in the San Francisco area. And a lot of small businesses like can't stay there, because of constant harassment. And I know that, like, again, if you have an illness, it's not your fault either. So it's just kind of like a lose-lose. What are your thoughts on that? And how, I mean, the cities are suffering and the citizens are also suffering. So it seems like everyone's suffering, from this epidemic, if you will. What are your thoughts on that? Like allowing people to steal and drug use and.
Yeah, the open drug use one is one that I'm not okay with, but I know there's been a lot of scholarship kind of talking about, like, just in regards to, is incarceration the correct way, or should we allow individuals to do that? Because then it gives them easy access for us to understand, like, all right, we know who's using and like what they're using, and we can get them services quickly. So I know that spaces, specifically drug use spaces, has been a big issue in San Francisco and California, or the creation of it, which will allow folks to kind of come into a space, use, but also receive services if necessary, and also care, emergency care if they begin to overdose. And I know that there's a lot of activists who are very much against this, and some who are seeing kind of the positives of it. So it's hard to see its effectiveness when there hasn't really been a lot of studies done in regards to it. In regards to the stealing thing, I think one of the issues is that it's a misapplication of the law, where folks just aren't understanding what the law is at this point in time, that they can still be arrested. They just can't be charged. But I think that folks are taking advantage of a loophole right now that folks aren't closing. But there definitely needs to be something done, because it has gotten ridiculous in the San Francisco Bay Area because of that. So I think that more communication between different groups need to occur. One of the issues that I've been dealing that I've been researching with in regards to Skid Row and specifically homelessness in LA is the lack of communication between the different federal and local like agencies. And so in regards to even like understanding who has housing available, HUD, the Federal Housing Agency, says that certain landlords have housing available, but if you were to actually talk to those landlords, they don't accept those types of vouchers. But on the list of available housing that we give to unhoused individuals, it says that those housings is available. And so that's just like an example of like the lack of communication that goes around in regards to housing. But I think that lack of communication goes around with other issues too, that we don't really know what the other side is doing, or in some cases we push the issue for a later date for someone else to handle, and then hope that they're able to clean it up and our hands aren't all over it.
Wow, your work is so important. I'm like, I don't know how. I know you just explained how you do it, but it must take like a certain kind of willpower to continue and like to continue to do this work, and really trying to solve a problem that's just seems like there's no end in sight. Because of and then the pandemic, and then the markets being down, and people losing jobs, and it's just a one after another. It seems like it's just a whole line of dominoes, and it's like, how is it, you know where is the light, and I, like I said, we were talking earlier, I lived in Los Angeles, and I lived in Venice Beach, and I love California. I love, the Cali lifestyle, surfed all the time. And from Massachusetts, I wanted to move to California. I had that, oh man, I can't wait for the Cali lifestyle. Everything's so laid back, and just, throw the shaka around. Everything's just chill. And now I can't see myself ever moving back. And I love California.
Yeah, it's still beautiful, and I love it. Like, there's moments where I catch myself. I was in Skid Row just a couple of nights ago, and I just like caught myself like, oh, this is a really beautiful place as the sirens blare behind me. But yeah, it's a place though that I think a lot of folks are trying to defend too. Like, a lot of folks see the beauty there, and they really want to make sure that other generations can come here and live here and still see that beauty. I mean, like, the people here are still the people here. As much as like people talk bad about LA, there is something, there's an optimism of like you can accomplish anything while you're here. And I think that's the thing that kind of keeps a lot of folks going, is that in a single day my life can change. And I think that's something, especially in these harrowing times, it's beautiful to kind of think that way. Question for you all, though, is housing insecurity and homelessness an issue in Puerto Rico? I know that you recently moved there. Is that an issue that you see happening there?
I'll let Jesse answer that because he actually has something written.
Well, we were kind of talking about it. I did a little research because, we live in the San Juan metro area, which is the vast majority of the population. I mean, about 3.3 million people live in Puerto Rico, and about over 2 million of them live in the San Juan metro area. And according to the statistics, I could find anywhere from about 1,000 to 2,000 homeless people on the entire island. And that's also considering that if Puerto Rico were to be a state, which of course it's not, it's a U.S. territory along with Guam and U.S. Virgin Islands and a couple others. But the average household income here, the per capita income in Puerto Rico is $14,000. The next closest state would be Mississippi, which is almost double that. And yet we have about the same homeless population in total as the city of Boulder, Colorado, which has a population of about 105,000. But a lot of people just are not very financially secure here, and they have a lot of more Section 8 housing. And I know the government does a lot more with quote unquote projects, but you don't see like walking around. Like I've seen a few homeless people, but I mean, you don't really see them. And I think she said the same thing. Like, you just don't notice it. I didn't come from California. I was in in Colorado, which Colorado also has
Yeah.
certainly. And, I was talking to I worked in law enforcement for 4 years in Colorado, and I was talking to one of my former coworkers yesterday before we kind of preparing for this. And he was a cop in Boulder for over 30 years, since 1983. And he said that he noticed a massive spike. He said that they're actually having a conversation at work one day. He said the biggest spike everyone noticed of the cops that have been there for a while was when Colorado legalized the marijuana. He says that was the biggest. And then he says, like, it's, Boulder, has jumped up. But he says Boulder actually wants to recruit homeless people for their city. I think something to do with property prices and kind of manipulating the price. I mean, we're loving Puerto Rico. It's, a much different culture. It's very much Latin America. You don't feel like you're in the United States of America. You feel like you're in Costa Rica or Panama. Spanish is the first language, and it's a lot more family orientated. Like our neighbor, him and his wife just had a child, and he wasn't allowed in the delivery room because he's a male. Only females are allowed during the delivery room because it's a mixed room. They had two couples delivering, and like on the mainland, I just can't imagine that.
Yeah.
I imagine someone the hospital getting sued for misgendering or some other.
Yeah, I was.
So,
yeah, I have a 21-month-old. I would be really upset if someone said I wouldn't be allowed in the room.
Yeah,
Yeah.
and him and his wife are from Seattle, Washington, and so they have no family around. So he was like, no, like I want to, be in the room. So they're like, okay, well then you can pay $500 more and get your own room. And then of course you don't have to abide by that policy. So it's just a lot more conservative. And I think really having that support system, like you mentioned before, I grew up in foster homes, so I know like what it's like not to have that support system. It's tough when you have no family. So when you're in Latin America, it's so family driven. I think that like something like that is massively important to have that support system. And
I think also the housing projects. I guess the one in Ocean Park. I guess they call it like Luis Llorens Torres. That was built here. I just googled real quick. That was built in 1953. It is the largest housing project in Puerto Rico and the Caribbean, and that houses about 3,000 people currently. And so it seems like that they have a subsidized housing, and so that probably might play a part in why there's not a lot of homeless on the
and the community
there
aspect
still are
too,
some,
like the familial aspect, like also would help too. If like if you know people, you can get out of a situation, or someone can help us in a situation.
Yeah, I was shocked. Like the first time I was walking down the beach, like we live on this about 2 mile long stretch right maybe 10 minutes outside downtown. And they have all these like kind of sections where like these palm trees and coconut trees. And I thought for sure I would see like tents kind of stuck in there, and like not a single tent. Sometimes you'll see a hammock or a day tent, but they're just like using the beach for the day. I thought for sure I would see some of that. And I'm pleasantly surprised. I'm happy that, and that's one nice thing about Latin America, where you do get that family and that sense of community. And I'm really happy to, that's one of the best parts of living in Latin America, is to be a part of a community that's so strong. Do you have any final thoughts? We've taken about an hour and a half of your time, which we really appreciate. I know that.
Oh no, this was amazing. Thank you guys. This is an amazing show. I'm excited to be a part of it. So thank you so much for inviting me. I think that this is a really important issue. Like I said before, that a lot of folks are amazed how interconnected a lot of these issues are, and how far back a lot of these conversations are, that we have been discussing this issue of unhoused individuals in this country for over 100 years. And we've had a lot of different strategies, but unfortunately, because we don't talk enough about it, we continue to go through the bad strategies of the past. And it's time that we finally kind of have these conversations and have them open in the public about what are appropriate policy strategies, but also how can we become more connected to the communities that we're we're in. I think that all of us know someone who not became lost, but became housing insecure, or kind of fell through the cracks. And I think that we realize that there are things that can be done to make sure that this doesn't happen again. And I think it's time for us to finally start doing that. So thank you. And hopefully your viewers will find this interesting and would like to know more about it. You can check me out on my website, drdouglasmungin.com, my Instagram, Dr. Doug, or my book, which is coming out in 2023, finally, Skid Row, the Battleground for America's Homeless Epidemic. And so that's going to be out with Beacon Publishing, hopefully in the winter of 2023. So yeah, thank you all so much, Kai and Jesse. This was amazing. And yeah, just contact me anytime if anyone has any questions. I would love to talk to them about this issue. I think it's really important.
Yeah, thanks so much for joining us, and I certainly will make sure I pick up a copy of the book, the Kindle version. But
yes.
But yeah, thanks so much, Professor Mungin, for joining us today.
Awesome. Thank you guys.
We appreciate
so
your work so much. And I just send you love and light, and thank you for continuing to do this work. And with enough people talking about it, there are bound to be new ideas on how to approach it humanely and kindly. Yeah.
Yeah. Awesome.
And that is it for this episode of El Podcast. We thank you all for watching and listening. And special thanks to Dr. Mungin for joining us. If you'd like to find out more information on Dr. Mungin's work, please find the links in the descriptions below. And also, if you're not subscribed, please consider subscribing on YouTube. And if you enjoyed this episode, please click the like button. It does help us out in the YouTube algorithm so that we can continue bringing more content to you all. Please follow us on Spotify or Apple Podcasts or wherever you get your podcasts from. And from the bottom of our hearts, we appreciate you very much. And we will see you on the next episode.